at the meeting last night, right? Correct? Okay, so you know me. All right. I just felt it was necessary to do a quick 101 on what lupus is. There's a lot of misnomers out there about lupus, but I would highly recommend, because several of you are new, I would highly recommend you sitting with Rita or making an appointment with Rita, and I will give introductions as soon as we get fuller, on the new patient education class. That class is about an hour and a half long, and it goes into detail. This is a quick flyby for those of you that may have very, very little knowledge about lupus. And I'm going to go real fast, all right, because the presentation for the rest of the program is going to start real quick. And the goal is to fill your heads with knowledge. And my prayer for you is that you take it with you. Okay, and Alex is just going to click, click, click. So we don't need to talk about who we are. I already told you that. And so the definition of lupus, it is a chronic autoimmune connective tissue rheumatic disease. You're going to go real fast. Okay, there's more than 1.5 million Americans who have lupus, so you're not alone. 90% of the individuals are women. Out of that, 80% of the women with the disease are 15 to 45 is the age bracket. But I know to be true in the organization that we have a lot of postmenopausal women who really, they probably had lupus and didn't know it, but it's probably a very large portion of our network. Women of color are at high risk. For every Caucasian woman, there are 2 to 3 women of color who have it. And unfortunately, they get it worse. Men do get lupus. Next. So men, unfortunately, I didn't see any men with us last night that had lupus. Unfortunately, when they get it differently. We don't know why. And that's why we think that one of the causes could be a genetic issue. So with genetics, you also heard me say last night that I have an identical twin. I praise God, my twin does not have lupus. Yet we're 100% DNA match if we speak about genetics, or does she have lupus and it never came to fruition? Environmental issues. You know, we were talking about Colombiana, not that they're going to get it, but I know that a large portion of men in our service came back from Agent Orange, and the VA has a very high population of men with lupus. Hormones is another issue. Next. What triggers it? UV lighting. Ooh. All right. You don't want to stay in UV lighting for a long, long period of time. Sunlight. You also heard me talk about me being in Florida every year, and they thought I would have sun poisoning. No, they were just trying to kill me. The sun is our enemy, and that there needs to be a topic on that all by itself so that people have a better understanding of it. That doesn't mean you walk around with the hat on your head and you have gloves. I had a lady come to the door one time. She lived in Alaska, and it was June, and she said she had lupus, and I went, yes. She goes, I'm allergic to the sun. I said, no, 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 no. You can't be in the sun for long periods of time, and if you're going to be in the sun, you need to use the highest UV rating there is. And if you don't understand UV ratings, ask your pharmacist. The number means it's like 2.5. That means like it's 2.5 hours. Okay, so you want to make sure you wear it. No sunbathing, no sun tanning boost. Stress could be a trigger. Medications can be a trigger. Infections, certain foods. Now, we really don't have much research about foods. We do know that alfalfa sprouts are not a good choice for us because they can carry microorganisms that cause bacteria in them. That is the only one that I heard that you should be cautious with. Chemical agents, different surgeries, vaccines, and hormones. And that's why hopefully this afternoon the doctor is going to talk about vaccines. Next. Lupus is different for each one of us. Okay, you guys are snowflakes in a pile. All right, beautiful but different in every way. It can range from mild to life-threatening. It's characteristic by flares and remissions. And even though you're looking at me and thinking, and she does all this and she's got lupus, I've had moments um, that have been awful. Awful. Okay, next. Lupus is not AIDS. Stop saying that. People say that. It is not. It's the complete good news is you're not going to get AIDS. It's the complete opposite of the spectrum. All right. It is not cancer. It is not arthritis, and it is not contagious. We had a lady call. She worked for a candy company. They fired her because they said she was getting AIDS in their chocolate. Okay. It is not contagious. Next. Types of lupus. There's discoid lupus, or there's cutaneous lupus. Now, that is lupus specifically of the skin, could be on the outside and or the inside. I remember one of our constituents' husband died, and they said when they did the autopsy on him, his whole body on the inside had lupus discoid on it. Neonatal lupus, of course, are babies. Usually, when they get it, after they couple months, it goes away, thankfully. And then there's SLE, my famous, I love to say it because it took me years, systemic lupus erythematosus. Next. What does that mean? Well, right now, I'm feeling pretty achy. All right. It's constant achiness, low grade fevers, gross fatigue. And the fatigue is like, oh God, I can't keep my eyes open. Or it comes 3 o'clock in the office, I look for chocolate or something because I'm like done. I'm like fried. All right. And skin rashes. Now, there's a skin rash that's called the butterfly rash. It comes across the bridge of your face. And I don't want to point anybody out in this room, but this is a perfect example of what this looks like. Okay. Now, oftentimes it could be confused as rosacea, or sometimes it does call for a biopsy. But if you've been diagnosed with systemic lupus, it doesn't. Some of the older rheumatologists really feel that if you don't have that butterfly rash, that you don't have full blown true lupus, that you may have undifferentiated or mixed connective tissue. So therefore, they say you have. For insurance company purposes, they label you already. I hate when people label us right off the bat. Don't let them do that to you. Okay. Next. What else can we get? Chest pains. Pleurisy is a huge issue. And these chest pains are so heavy, you get fluids in your lungs. Hair loss. Believe it or not, I lose my hair. I lost a great deal of hair last year. Um, in my other life, I was a hairdresser. All right, so I do have some techniques that might be helpful. We actually did a podcast on hair. Um, Mouth sores. So I had oral sores in your mouth. You'll be going to the dentist more often and probably with poor results. Photosensitivity, anemia, Raynaud's phenomenon. Most of us will have Raynaud's, or will have fibromyalgia, or will have, there's quite a few of them. So remember that I said this to you. In a few years, they're probably going to relabel lupus. They're going to call it a spectrum of diseases because usually you just don't have it. You just don't have one thing. It has its brothers and its sisters. And I don't want that to scare you because if I walk around and said, rattled off the 7 different diagnoses I had, people wouldn't come near me. All right. Repeated miscarriages, that could be saved with an aspirin today. We know this now. Headaches, dizziness, depression, seizures, cognitive dysfunction, that's me, and memory disturbances, and that's me as well. Luckily, my staff picks up on me every once in a while, and they can continue a sentence for me. All right. I still function. They don't throw me away. Next. Organ involvement. Kidneys is huge, and we're going to have someone talk about kidneys today. Kidneys is huge. Now, you don't come out of if you're coming out of the gate with kidneys, um, you need to be in the right hands. You need to be in a specialist who understands lupus nephritis. Unfortunately, today during COVID, we came out with 2 new medications, first time ever. Now, my uncle had lupus nephritis. He did have a kidney transplant. He did live several years. He's gone now, but kidney, even if you do have kidney issues, you want to get a handle on that. All right. The lungs, central nervous system. So for me, I have CNS lupus, which is of the central nervous system. I had a stroke, and praise God, my motor skills are only off by 10% on my left side. blood vessels, blood, and the heart. We are going to be doing a program at the end of May, and we will talk about the heart. And the heart problem is a big one because the constant inflammation that goes on in our body puts pressure on everything connected to our heart. So we want to pay. Do not be surprised when you go to see your doctors that they add a cardiologist to your list of providers. Okay, next. Medical history. They're going to look at your family history. There is, okay, here's another one. When people say I got tested positive for lupus, there is no such thing. Okay? There is no specific test used in the United States today that says you test positive for lupus. What it is, it's a family history, it's a complete physical exam, laboratory test, and maybe a skin or kidney biopsy. And they're not going to do a kidney biopsy unless your urine protein in urine is way off. Um, what are we looking for? They're going to do process of elimination. All right. Next. What are they looking for? So there's basically they say there's 11 criteria for lupus. They added 4 more this year, and you'll learn that in the new patient education class. What are they looking for? The older rheumatologist believes a butterfly rash is a given. All right. A discoid rash, which is different. Photosensitivity, oral ulcers, some type of arthritis, ceratosis, kidney disorder, neurological disorder, laboratory test, immunology disorders, or an anti-nuclear antibody. So most of the time, they're going to come back and say you have a positive anti-nuclear antibody. That's the first signal. But there's 15% of the population that does have positive anti-nuclear antibodies but doesn't have lupus. Next, it is a very difficult disease to diagnose. If you get diagnosed early, God bless you. Okay, I want to know that doctor. It took me 19 years. I'm in a different time warp now than you guys are in a better place than I was, but it still could take up to 6 years before you get a sound diagnosis. Okay, treatment plans. It's a team effort. You're going to have all the ologists there is neurologists, nephrologists, rheumatologists, gastroenterologists. You're going to be friends with the gistas. They're going to tailor make it to you, and it's going to be tentative, and you could each have a different treatment plan. So this is my disclaimer of the day is this is an educational event. This is not us telling you how to treat your lupus. Your doctor is the best person to do that. Okay? Who does it? Ugh. Your family practitioner. If he knows lupus, keep him. Okay? That's a treat. An internist, a rheumatologist, clinical immunologist, dermatologist, nephrologist, and other specialists. So it's the ISTAs. Next. What type of meds? NSAIDs, anti-malarials, corticosteroids, immunosuppressants, and now today we have a lot of bio stuff, which the two girls out front represent GSK and Aurinia Pharmaceutical, AstraZeneca, all came up with a biologic. Most of them are infusions. I understand some of them now can do injections, but have a conversation with your doctor. You may not be there yet. Usually when you get to this, they're going to try Plaquenil first, okay? Which is an anti-malarial drug that was used for malaria, but we found beneficial for lupus. Next. No problem. Complementary, okay, I hate the word alternative medicine. We're not going to use that word anymore, okay, ever again, okay? We can use companion therapy though, all right? And if you're venturing off to do those other things, you need to have that conversation with your doctor. And if you're going to do a vitamin thing, you need to have that conversation with your doctor. Some of the vitamins may work against you. Some of the vitamins with your medications may work against your medication. And when we talk about Plaquenil, if you're on Plaquenil and if someone in your house smokes, you're defeating your purpose. Smoke and Plaquenil don't work together. All right, so you're going to stay away from people who are heavy smokers. It's important to remain under the care of your doctor. Any serious symptoms. So how do you know when it's lupus is the question. How do you know if it's just something else? That's the biggest challenge that a lot of us have, and we don't know. So, everybody pretty much has a my chart today or some type of way they can communicate. So if a fever's there, you need to call your doctor. Okay, before making any changes in your treatment, you are not the doctor. You paid to go see him. Okay, don't play doctor. Don't share drugs. And for God's sake, take them as prescribed. And take them when you're supposed. My damn guy's laughing at me because I have pill plates on my desk. I'm on like 27 pills, okay? And I am the worst complied person in the world. And if you take them all at one time, you could get very sick. Okay. Preventative measures, space yourself in the sun, okay? You don't go out in the sun from 12 to 4, not when it's at its peak. I do have a convertible, all right? Ever since I had my stroke, I have this thing about the wind in my face, okay? But I'm certainly not going to drive around at high noon in my convertible. I'll do it in the morning or I'll do it in the afternoon. But it's not, I'm not Susie Sport Cars and riding around the place killing herself, all right? You do need rest, okay? I need 10 to 12 hours sleep or I don't function, or the inflammation will come, or the gross fatigue. Please don't be mean to yourself. You can get through this to have some type of new normal, but you need to take charge. Nutrition and diet. So we know that this is a big topic. We've done a couple seminars on this. We've done a podcast on this. I know I'm surrounded by vegetarians at the office or gluten-free people at the office, but I'm Italian, okay, and my family and I own an Italian restaurant, so I'm going to be a fluff chick no matter what, okay? But nutrition and diet, the thing that we heard most is from the Cleveland Clinic is they call it the Mediterranean diet, and they may even have it on their website, okay? So that there is no, everyone keeps looking for this diet magic. Some people will say, they stopped eating meat, so they stopped eating, you don't have to be in jail because you have a chronic disease, all right? You just got to be smarter. Moist heat for inflammation. Don't put heat on top of inflammation. It's not going to work. Prevent infections, and do not smoke. Our demises mostly, sadly, is we don't die from lupus. But if you get an infection or pneumonia, you better call your doctor because that's the devil in the room. Next. Yeah, well, we get depressed. A day without Prozac for me is a day without sunshine. So I suffer severely from depression and do not take that lightly. I went through pain management and psych therapy for 2 years. And I used to hide it, and I don't hide it anymore. The governor here in Ohio recognizes that depression is running rapidly, and he put in the budget a couple $1 million. So if anybody needs mental health, there's no reason why you can't get it today. And sometimes it's just getting help, sorting things out. Uh, it can disrupt your normal routine, so you're going to make a new normal. Physical activities, yeah, I'm not going water skiing or running up a mountain anytime soon, but there are other things we can do. Relationships, it puts a huge strain on relationships. The divorce rate is 50% amongst us. That's another conversation for another day. Relationship, sex, pregnancy. Most women today actually do have normal pregnancies. I remember when I was pregnant with baby Billy, he told me, it's you or the baby because you already have another baby. And they thought I was going to have my kidneys fail. And they were fine. And during pregnancy, I went into remission. So God is good. Medical care, if you don't have it, that's a problem. That's a problem. So we have to figure out how to correct. There's a lot of free clinics in town. There's a lot of hospitals that have social responsibilities, and hopefully we can help you with some of that. Insurances, life insurance policies could have an impact. Your self-esteem, you feel like, where's you? Where's my old me? I want me back. I want me back. Okay, well, we're going to make a new you. Okay, employment could be a challenge. We have a lot of people that their employees don't understand what they're going through, and some of us can be whiners to a different level, and they lose their jobs. And the impact is your income. Um, I'm going to tell you right now is a great time. If you're not working right now, and if you don't think you can work full time, it's a great opportunity for people to get part-time jobs. Anybody will welcome anybody because we can't get any. The workforce is so limited. They're happy to take anybody will take you on for 3 or 4 hours. Better than nothing. A couple times a week. And you know what? You're going to get dressed. You're going to feel better. You're going to see people. Next, because he keeps looking at his watch. How we doing? Okay. Coping strategies. Oh, good Lord. All right, sit with me at lunch, and I'll tell you all about this. All right. Coping strategies is a conversation that starts with education, getting the right facts. It's not AIDS, it's not cancer, okay, it's not contagious. Early detection is key. Okay, damages, take care of it before damage is done. Um, Acknowledge your fatigue and master it. You need to have a healthy relationship. If you are surrounded by negativity all the time, you will be a sponge and you will be negative all the time. Okay? Take care of your regular health, your teeth, whatever else you got to do. Pain management. I took pain management for 2 years, along with stress. Support systems. You need a buddy. And it may not be your husband. It may not be your mother. It may not be your sister. Because, and that's another issue, is we take everything we have. Oh, my arm hurts. Oh, my knee hurts. Oh, my hair's falling out. Oh, I feel terrible. And I'm throwing it at Bill. I'm throwing it at him constantly. Well, what's he supposed to do with it? The poor guy loves me. So now we have caregiver syndromes going on. That's what support groups are for, with each other, because you get it. You get it. So join a support. There's no reason why no one doesn't have a support buddy. Okay. We have telephone ones, we have prayer groups, we have in person groups where you can just call the office. There's 10 of them in there. They're happy to listen to you and they're very knowledgeable about lupus. Half my staff has lupus, so they get it. Uh, and here's us. You have us. There's no I. Next. Life skills, patience, humor. I kid around a lot. I really do, but I take lupus very seriously. Watch something funny. Tyler Perry, okay? Anything funny. It has natural endorphins. Laugh, laugh. Get the endorphins up. You got to be more organized. You got to prioritize. I have 3 legal pads, one for my house, one for the Lupus Foundation, and one for my other businesses. And I write everything down every morning. Do I get to all of it? No, but at least I can see what I did get to. You're not going to get it all done. Stop being superhero. Uh, Pace yourself, coping skills, communications, knowledge is power. Go to work. Go to work. Control and acceptance. Why do I want you to go to work? Because I want you to get out of the bed. I know what it's like to just lay in that bed. You're not getting anything done. You're not feeling any better. Okay, get up, comb your hair, put some clothes on, go to work, see people, have a purpose, figure it out. It's okay. It's either okay or it's not. Okay, next. What is the prognosis? 80 to 90% of the people with non-organ threatening form of lupus can look forward to a normal life expectancy. Look at me. I'm 71. Who'd have thought? Who'd have thought? Follow your physician's instructions. Take your medication as prescribed. Seek medical help when you need it. Next. Yay! I did it. I did it. That is Lupus 101. Each one of those topics, we can go into it in detail, but not today. Okay? That's what the new patient education class is for. And I would encourage you to find a lupus buddy or participate in a group or come to our many events. I don't want you to be lonely and miserable. It is a tough journey, and we thank you for coming. Okay? Am I done? Can I go home now? Any questions that I might try to answer for you right now?